Hi there, Rick Hansen here. Thanks for checking out the latest episode of the Amazing Greats podcast. Now, in this episode, our producer extraordinaire, Klem Daniels, again rocks the microphone in the second in a follow-up episode with Care Tuk, who we originally interviewed back in February of 2021. I'll get you up to speed here a little bit. After multiple battles with cancer, a near-death car crash at the hands of a drunk driver, then a brain bleed that left her to learn to walk and talk again, plus the unexpected death of a child, Care Tuk knows a little something about survival. A lot has developed since the last conversation in February, including the release of her new book. It's called Don't Wimp Out. Here's Klem Daniels and Care Tuk.
Thanks, Rick. I'm Klem Daniels, and today we have a special guest who is back for round two because there are some new things going on in her life, and we'll tell you all about it today. Her name is Care Tuk. Now, chances are you've never met anyone like Care Tuk for so many reasons. She's extremely unique, but her uniqueness lies not only in her charm, her smarts, her stubbornness, her faith. Care is unique by really no fault of her own. The side effect of an experimental fertility drug her mother took back in the 1950s. Care's been suffering with cancers, 14 in all. 4 of those cancers she has right now. We'll talk about that as well. She's had over 120 surgeries to repair and replace several body parts. And she had a facial rebuild after a horrific car accident that almost killed her. She's the author right now, recently, of her second book, Don't Wimp Out, Finding Faith, Courage, and Victory in Life's Daily Battles. She's the toughest lady I know. From Wasilla, Alaska, I introduce Care Tuk. Hi, Care.
Hi, Clem. How are you?
Great.
We call ourselves the chosen frozen up here, but it's going to be 70 degrees and awesome. We don't often get nice 70 plus days.
I don't get it
up here.
And this is May, right?
This is May.
The end of May, and I'm in Seattle, and we're 50 some degrees today. So go figure. I don't know.
Yeah, go figure. My husband found a block of ice still, though, yesterday when he was tilling the garden. So, anyways.
So today is I understand it's a special day for you.
It's really a special day because of the DES, and the DES is the drug to prevent miscarriages. It was, as you said, an experimental drug. But one of the side effects they didn't know that would happen would be that the female offspring would be infertile over 80% of the time, and sometimes higher. And I happen to be in that category. And so while we had really wanted to have kids and tried to have kids, we didn't know that my mom had taken DES. And then we decided, well, adoption. Adoption back in the 70s was really expensive. And we were getting rejections right and left. Bill would be staying home. That a house husband or a guy staying at home and raising the kids was not acceptable. We didn't argue right. We didn't, is this, that, or the other thing. But on May 25th, 1979, a baby bundle, Jamie Marie, came into our life. An unselfish young teen mom knew that she couldn't give her a life at that time, that she would want to give a child. And we got Jamie on loan for 40 years.
And so Jamie's birthday is today. How?
Correct.
As we're introducing Jamie to this interview, to the people that are watching, how old would Jamie be today?
Jamie today would be 42.
Jamie's no longer with us. You want to?
Yeah. Actually, it would have been a year and a month after her 40th birthday. She was pregnant, 23 months pregnant with her third grandchild. And she always had trouble with heartburn in her second trimester. And she was out on the couch, huddled under a blanket, and she had heartburn. And she got on the computer and was Googling heartburn. And yes, she did have a heart defect that we didn't know, which you most often women don't know until their 30s. And heart disease is one of the main killers of women. But the ME, the medical examiner, explained to us her heart just stopped. And so we get this call from her husband, saying, Jamie is no longer with us. And yet, in every sense of the way, Jamie is still here. I can see her sliding on the Northern Lights. I can see the delight in her kids' faces. I can see it in her husband. Everything. So unexpected, hard, but okay.
It's terrific that you're able to feel that way when other people might take it a different way. We're going to talk about that today. We're going to talk about the emotions of suffering, emotions of death, your experiences with death. Why don't we start with that? I mean, you have been clinically dead, what, twice in your life?
Twice documented, but 3 times unofficially. It's a very surreal. If anybody has watched the movie with the little boy, I can't think of the name of the movie right now, but of the little boy, it is exactly that. The first time I had a blood clot in one of my chemo port lines, and my husband was, we were in the ER, and they were doing CPR, and I could hear my husband yelling. It was like I Dream of Jeannie, and I'm sitting there cross-legged looking down and wanted to just blink. But I heard him yelling, "Don't you dare leave me here without these, to raise teenagers alone. I'm not doing this thing alone." And so I chuckle over that. And then the music overhead was "Can't Live If Living Is Without You." And I kind of looked up.
They actually played that in the hospital.
That has to be the music that is on right now.
Oh, that's
and
funny.
So that's been really, really funny. And the other one was another one when I was real close, and I got to the gates, and a friend was my occupational therapist, who happens to also be a friend, was right next to me. And he said, I've never heard anybody argue with God. You were just ticked off at him. And I said, yeah, because he wouldn't let me in. I said, I don't want to go back. I don't want to go back. And then I obviously it kind of got, yeah, you're going back. So
the gates, I mean, literally gates.
It's not so much gates, it's an opening, and it's like, it's no other colors or sounds or if anybody has happened to watch The Shack, and there's a scene in there with all the wildflowers and his 5-year-old daughter comes running, it's his assurance that she's doing okay. It's like that. It's indescribable.
How old were you?
Awesome.
How old were you in real life at the time?
At that time, I must have been 45.
How
50?
old? How old was your body in heaven?
I don't know that.
Did you
there
notice?
Really was a body. It was more of an ethereal. It was a spirit moment. It was a soul. It was a heart. It's a heart issue. It's so much a heart issue. And I don't mean the one with the aorta and everything else, but it's the feeling, and it's being there, and that you're loved, that the body doesn't matter. I happen to know Johnny Erickson Tada, and we laugh. She says, yeah, the day she goes to heaven, she knows where her wheelchair is going. And I said, yeah, the day I get to heaven, I'm just going to ask God to make sure that wherever my room is, that I have non-skid gold floors, because I've had enough of being titanium rods and
Yeah.
screws and cages and everything else. So
Yeah. We'll get into that too. Um, the reason I asked about the body was because I have read or heard several people say that you are uh, the best looking that you ever were in your life. So you're at your peak probably in your 20s. Uh, yeah,
hey,
I,
I think
I
I look pretty good for an old geezer.
well, yeah, right, right. But I mean that I'm
Yeah.
thinking heaven, so it's yeah, it's an experience that is very similar across the board, but there are some subtle differences in each person's
And I think that that
experience.
personifies each person's own relationship, own
Mm,
faith, no matter what it
sure.
is, what they've walked through, what they believe,
Mm, yeah, yeah, I'll bet.
and yeah.
So anyway, you were pulled back. It wouldn't let you in. St. Peter wouldn't let you in, and then what happened? How did you know you were going back?
Well, it was kind of a slow process, because it's almost, I don't know if you've ever fainted or blacked out. And you kind of have these at first, the curtains just kind of come in and close, 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 and then you're out. Um, this was almost a similar feeling. I felt myself just kind of getting further and further away from the colors that seriously are a lot like the Northern Lights or wildflowers or whatever, those colors to me. Um, no, I didn't hear any harps or that type of thing for me. But I just felt myself being pulled back further and further. Um, and there I was, back in my hospital bed
Yeah.
with my OT sitting next to me.
Wow. It freaks people out when you've been clinically dead for whatever period of time, and then you tell them stories of things that happened.
Oh, I just tell them, it's people. The one question I get a lot now is, and it goes back to the day that Jamie passed away. And she passed away at early in the morning. And on our drive into her house, Bill said there are two questions that you don't ask. I really don't even go there with me. It's why and why now, because that's above our pay grade. When God wants us to know why, when he wants to know why now, he'll let us know in our timing. And I think that that's really true. But also I think God doesn't want me up there mucking stuff up.
Well, there's got to be a reason that you're not there already. Which,
Well, I'm
to
hoping
be
part
honest
of
with
it
you,
is that I can still encourage people, and even being set aside as I am, that we can still show people that we have fun. You can, even though you might not be able to do what you want to do, there are many, many things that you can do. And that's my part. Is it a struggle sometimes? Oh, sure.
oh yeah,
Oh, sure.
understand there.
I recently, just as recently as a month ago, got into something and the doctors weren't sure what it was. Well, we do know what it is, but they don't have a real name for it yet, other than it's affecting part of my stomach, pancreas, all that kind of stuff. And he said to me last week, we all 15 of us across the country weren't sure we were going to be able to pull you through. And I said, well, that's probably because you're not the great physicians. I have the great physician as the head guy. You guys already appointed me as COO, but
Yeah.
it is hard when there's nothing more that you would love to do than to get out of Dodge.
Mm-hmm.
No more worries, no more anything else.
You were just talking about something that this audience doesn't know about. It was about 2 weeks ago. that you're referring to?
Yeah.
Okay,
Yes.
why don't you explain what you were going?
One of the cancers that we've been battling with, and they're calling whatever this is a neoplasm, but it's in my bile duct, and it's true to Care Tuk style. It's twice the size of anything that any of the doctors have ever seen. They've only found one research paper that had someone whose duct was dilated to 10, and mine's at a 20 as of 2 weeks ago.
Wow.
It means I get to, change my diet to full liquids and softs and that kind of stuff. But it's a good thing I like smooth peanut butter and toast. And Bill makes awesome soup bases, so that's not a problem there.
Wow. You're, we didn't talk much about Bill last time around, but Bill has really been just a saint as a husband. I mean, he has set the bar so darn high that none of us can ever reach that. Bill's a big burly guy who wears shorts in the middle of winter in Alaska. He just comes off really as a big tough guy, but he's really a teddy bear.
Well, and he only wears t-shirts with sleeves on them once it gets about 5 above, and he might wear a coat at 10 below, maybe. But I would say the hero in anybody's story going through things, and especially mine, is the caregiver, caretaker, or in my case, taker of care. And he has done, he walked into our marriage knowing we thought it would only be one bout. We weren't counting on as many, but he is so gifted and he is so wise, and he is the only one other than God that can probably keep me in line.
You take these vows when you get married, and I understand he missed something in your wedding vows. What did he forget to say?
He forgot in sickness and in health. And I kind of wonder, yes, we had lawyers coming after us, saying, why don't you sue? Why don't you sue? You could get great money. And we thought, you can't put a price on life. But, I teased him the other day saying, hey, you left out those. I wonder what life would have been like. And he goes, well, you've done a lot in your life, lady, but, you haven't done very well at that till death do us part. So I said, okay.
Wow.
Point well taken.
Yeah. Well, what a great guy he is, and you're very lucky.
We have, but the probably, Clem, that I can say why we've been together, because most marriages, there's a high percentage. I've heard as high as 90% of marriages won't last if somebody is ill, chronic illness, right. those type of things. But when people say, what makes you guys stick together? And I said, Bill will tell you, 1, because he made a promise, and 2, he doesn't break promises, and 3, especially to God. But we started our relationship as best friends, and we encourage anybody who wants to enter into any relationship that you got to be friends, because when you're best friend, you're not going to just walk away forever. You may be ticked for a while, but you always come back and you always share those special things with them. And so we're best friends.
One thing I read in your new book is when you were going for adoption, one of the questions, you mentioned this earlier briefly, they asked about how do you handle an argument?
Oh,
and you couldn't answer the question.
We could not. And at that point, we'd been married a couple of years. And even really to this day, we don't really argue. I did give him a salt box thing that hangs, a salt box that hangs, plaque that hangs in our living room. It says, "I'm not arguing. I'm just explaining why I'm right." And so, yeah, it isn't arguing. We always talked it out. And we kind of had a signal of timeout. Okay, this is getting where we don't want it to go. So we'd time ourselves out, just like we did with our kids. And then we'd come back and we'd talk it out. And then we'd end up, well, making up is never hard to do, but
Right.
with hugs and kisses and praying and just, you know, trying to understand.
You turn it over to God to kind of work it out for you.
Or help us to understand how we're supposed to work it out.
Right.
In a lot of ways, Bill and I are polar opposites. You know, I haven't found anything that he really can't do. I mean, he was out this morning already, rototilled and disked and leveled the half-acre garden that we're going to put in. But, you know, it's like an Italian dressing. Okay, you know, when you have a bottle and the oil separates from the other. Well, that's Bill and me. We both have our own flavors, but one of us, the oil's there and the water-based stuff is the other place. Shake us up and we make a darn good salad dressing. And that's how I describe us.
Yeah. Well, it's a very important part of life, but certainly what you've been going through since you were what, 14? 16? 16, you had your first.
Well, yeah, 13. Actually, yeah, 13, right around there.
But you had
teen years.
Knee surgery was your first surgery?
My knee surgery was the first one.
Let's go through your body parts. You ready?
We're ready.
Okay. All right. Where do you want to start? Let's start at the feet and work our way up.
Okay. From the feet, I've got fused toes because the neuropathy from the chemo was so bad that I was not getting blood to part of my foot. So they had to fuse toes so that they wouldn't have to amputate them. Both knees are total knees, but the one is a prototype that was used in a study, and it has a long rod going from my knee down to just above my ankle, and then there's a spacer bar.
Titanium, right?
Excuse me?
Titanium.
Yeah, titanium rod.
Mm-hmm.
And then there's a plastic piece in there, and which is called a spacer, that they put in it mimics what cartilage or meniscus would be. And then I have from the knee up to about 3-4 inches of my thigh, a femoral rod of titanium, or femoral piece that they fashioned for me. And then the car accident, I had my face rebuilt. I've had my shoulders rebuilt 10 times. After chemo, I ended up, my bones are more brittle. And when I fell, I hit the palm of my hand and it shattered my humerus. So I got more screwed up and got a plate and 10 more screws. And then they eventually had to take those out. But one of the great things about having so much titanium is you can't hurt titanium. You can sure bruise around it, but you can't break it. So that's a plus. I'm fused surgically in 4 places in my back, but the rest is all but one disc has self-fused. Again, they're thinking that's due to the DES. And then the brain got injured not only in the car accident because the bones got shoved up, and things got scrambled, jaw broken, everything, those kind of things. But in 2001, during 9/11, I had just gotten into rehab the day before. I had a 3-compartment subdural bleed that we still to this day have no idea where it came from. I didn't fall, didn't have, it wasn't anything. I had a funny headache, and the doctor said, humor me, let me take an x-ray. Then he says, I want to do a CT. And then it was, no, you're not going home. You're not driving. You're not doing anything. And I did go home 3 months later, after they took everything out, and I had to learn how to walk, talk, speak all over again. And then, as my charmed life goes, just after Jamie's death, with cancer, you have yearly workups, and it'll be CTs or MRIs or PET scans or whatever. Well, I had taken mine, and it showed that the hardware in the arm with the plates and screw were starting to fail, and 2 of the screws were coming through the bone and starting to damage the muscle. So they needed to get that out. So they got that out. But what was even funnier was I could hear right before I was being wheeled towards surgery is a couple doctors were talking, and they said, "You're doing Care Tuk? Are you crazy, or are you just stupid?" And so they were they said, "I sure hope you have a plan B." Well, he did need a plan B, and the plan B ended up being a blessing in disguise, because the day after recuperating, I'd lost a lot of blood. They did some blood work, found I was way low, gave me some blood, and then I had a reaction. And they think it's because with chemo, with me, my core temperature has dropped, and the blood wasn't warmed up. It's a technique that they can do, and they usually do, but they didn't. And so here I was having this reaction. They're wheeling me down to ER and doing CTs and MR and heart stuff and everything else. And lo and behold, they find a brain tumor. I mean, who goes in for shoulder surgery and comes out with a brain tumor? Care Tuk. So we deal with that, and then because of that, after they did more CTs, they came back and did a PET scan, only to find that I had a tumor in my 6th and 4th rib, and there's nothing they can do. The 4th one is infinitesimal right now, and the one on the 6th rib, they can't do anything about, because it sits right, it's attached to the lining of my lung, but it sits right next to where the main artery of the heart is. So they can't touch it. So we said, there we go. And then you just live your everyday stuff that you go through just normally.
This is today. How long ago was that? Did you get the diagnosis on the brain tumor and the bile duct cancer and the
eye?
Yeah, well, you haven't mentioned that yet either.
Yeah, I forgot to mention that. They think there may be it looks like a tumor is forming behind the left eye, which, if it is, would be from the car accident, because it was where part of the injury from the car accident was, where I got direct impact from. But the bile duct has just been within the last 6 months or so that we've really been able to narrow that down. 6 months to a year, it started showing up on there.
The bile duct cancer is the most serious of them all. I understand of the 4 that you currently have. What is the prognosis? What's the prognosis there?
Oh, it's the same as yours. terminal.
Same
We're
as
all terminal.
Oh, we're all terminal. I understand what you're saying. Some sooner than
Yeah.
others. Yes.
With the bile duct, the doctor told me last week that he said there's almost no point in doing more scans or that. Yes, we can keep on top of blood work, but we will know if God doesn't come first, or I don't get hit by a moose. This is what would probably take me out, and that will be that the duct will close totally off, and they have no explanation of why it hasn't already, because at the level it is already, I should be looking like a minion, a yellow minion. And he
Great.
said,
I mean,
once you start turning yellow, you have typically 4 weeks to 4 months. But he said, but there's nothing typical about you, so we don't know.
Well, I mean, we haven't even mentioned the H1N1 that you contracted how long ago on a flight down to Seattle or something for some
Right.
surgery?
That was 10, 11 years ago. I think H1N1. I was down, and I had taken a flight over to Spokane for the weekend, and that was the weekend they put Washington State University under quarantine because of H1N1. And I came back, and I had an orthopedic appointment, and all of a sudden I started showing signs of the H1N1, and it was tough. It was tough partially too because I couldn't go home until I was, kind of clear 10 days. But if that hadn't happened, the first book wouldn't have happened, because while I was, the people who graciously let me stay with them had a son who worked with Luis Palau, and he was my editor and kind of consultant, whatever you call them on books, head guru. So yeah, it's pretty cool.
So, and did you stay in Spokane to recover? Is that what you did?
No, no, because the person I was staying, I just went over to Spokane for the weekend, and so they figure I got it on one of the flights back, since there's so many flights with
students.
Yeah, with students, that I probably got it then. But I stayed with other friends.
So you're a survivor of N1H1. The only thing that you just had to stay away from completely was COVID, and you didn't.
No.
You and Bill contracted COVID, and you have all of these things going on in your body and your life, and you would think that your immune system was just totally destroyed.
Well, it is. In fact, I can't, it's why right now I'm still on liquids, and will be, but I lost it. Sorry, that's part of having several brain surgeries. Sometimes you lose it. My husband calls it all the timers. I call it some of the timers. Most of the timers. But
you were talking about COVID and how
the COVID, we figure the day that I was exposed to it was the day that Alaska had their one of their first cases, and it came from a pilot who had flown from China, actually. And he happened to be at the hospital at the same time I was. We didn't know anything. I mean, think about it. A year ago, March, nobody knew anything. So nobody was quarantining or anything else. So he was in an area where we were. So, and for us, blessedly, it was just like a bad flu. I wouldn't wish it on anybody, but I wouldn't wish a bad cold on anybody either. Yes, we have to take precautions. We have to be vigilant and be aware, but my take is one day at a time.
Well, God he keeps putting a spotlight on you, and he holds you in the highest of highest regard for a representative on this planet for the people. I just, we just don't know people like you that have gone through what you have, but have this wonderful faith experience that just continues to keep you alive. What are your thoughts on that?
Well, there are a couple things. One is, yes, I do have faith, and it's my faith. It's a relationship. It isn't a, I happen to be a Christian. Just like if you go to McDonald's, you aren't a hamburger. Just because you go to church doesn't mean you're a Christian. But I happen to have a friendship with God, and tight with him, and that and staying close with him, even when, there are times that you can't read, you can't concentrate, those types of things. And that's why he says, you hide hide my word in your heart. And that has sustained me, because there will be little verses that kind of keep going around and around, and you'd be surprised at the ones that really you remember and why you remember them. And in the dark nights in a rehab center, or on a middle of the night when you can't sleep, or when you're out recycling, everything after a chemo, and life is fragile, so you handle it with prayer.
I was going to ask, if you could say anything to the rest of us, is what advice would you give based on your life experiences, and possibly to take into consideration where you're going here, and much sooner than we all want that to happen?
Well, one would be, I learned this a long time ago from one of my clients, and that is, you can either be in pain or you can be a pain. So your attitude has a lot to do with it. But also, don't make it more than it is, but don't make it less than it is either.
A lot of times there's pain, and there's lots of pain with you, but there's also the wear and tear on the mind, on the body, and that goes along with that. That is difficult, and the combination sometimes. You throw depression in there along with other.
Oh yeah,
and all of that. That's a lot to encounter.
I keep a sign on my desk. It says, "Give yourself permission to leave something undone today." And I also have Larry Boy from VeggieTales, who has a button on it that says "No whining," and that's kind of where don't wimp out. We don't get to choose the number of days, the number of hairs or lack thereof on our head that God counts, but we just one day at a time, and make right choices, and don't worry about tomorrow. You take today. Today is a gift. Right. Unwrapping it, unwrapping it, open it up after you've unwrapped it, and see the gift of today. Every day you can find something. Find one. If you are in the deepest, on my deepest and darkest days, I would force myself to find one good thing that had happened. Focus on the good. Focus on your attitude.
Mm-hmm. Mm-hmm.
Because, and it's also hard because I'm not looking at me. Bill looks at me all the time. Other people see me, but I don't see me necessarily in the same way they see me. So I want to be the best that I know how to be, which is to be a keister kicker, to use humor, and on days when I can't do it, I take the phone off the hook and put the cell phone on mute, and it's okay.
Your book, Don't Wimp Out, Finding Faith, Courage, and Victory in Life's Daily Battles, is a title that certainly suits you and fits you well. And you have a lot to say. I guess the one thing that I don't quite understand is, where do you find the energy and the time, to write not only your first book, but the second book? How did
the first book I wrote, that was my way of dealing with chemo, because you'd be sitting hours on end in a chair being hooked up to an IV, and I would write there. I've always been a journaler, and so some of the stories came, from there. On this second book, it's been actually written for about 3 years, and people keep saying, "So when's it coming out? So when's it coming out?" And I'm saying, glitches keep falling in the way. Throw in a 7.1 earthquake, throw in COVID, throw in whatever.
And since the time of her interview, her new book, Don't Wimp Out, is now available. And you can find it on her website at caretuk.com. That's caretuk.com. In the meantime, your first book, Loose Screws and Skinned Knees. Loose Screws and Skinned Knees.
And it's because I really do. I have a loose screw right there. You can see.
Yes. Yeah.
Well. But I asked them, why won't you take it out? And they said, well, that's old school. And I'm going, old school? I said, fine, I'll just sterilize it and go out to my husband's shop and take his, reciprocating drill and just
pull her
get
out.
it out. It says, I don't think,
Well, Care, it's been a pleasure.
Thanks.
To have the name Care too is almost ironic. It's just, it couldn't.
It's me.
It couldn't be a better name for a person like you.
Thank you.
Who has given so much care and deserves so much care and is in the care of God Almighty. And you are an example of his what? There's so much. I can't even find an adjective for it.
His grace. But you know what, Klem?
Yes, grace, for sure.
It's because of people like you who are Jesus with skin on that help fuel me to be the me I can be.
Well, thank you. And it's a pleasure to talk to you again. And we wish you nothing but the best. And
thanks.
Please be around here for a while, will you?
Yeah. I want to see some more warm weather.
Yeah. All right. Thanks, Care.
See you in the funny pages.
Thanks, Klem and Care. What an amazing story. Well, if you missed the first conversation with Care Tuk, check out episode 4 from February on the Amazing Greats podcast. And thanks so much for taking some time to hear this amazing story and to hear how God continues his work in all of us. If you were moved by something that you heard today, or something you struck you as being something important for someone you know to hear, please go ahead and share with a friend. Thank you for watching and listening to the Amazing Greats podcast and making it a part of your day. Until next time, God bless.